All right. For this week, I had a patient in the clinic, born in 1955. Date of birth is 8 to 10. Initial will have KL, switch those around. She's a 70-year-old female Caucasian, presented to the clinic with her daughter, and appears to be a reliable historian. Her chief complaint was that her back has been hurting for months. It's become hard to do her daily activities. History and present illness for the patient. She's 70 years old, presenting with complaints of chronic pain beginning about 6 months ago. She describes a dull ache to her lumbar region, radiating occasionally to her upper buttocks, but not her legs. The pain worsens with prolonged standing, like standing or cooking, walking, things like that, and during things like shopping. The pain worsens with walking, but is relieved a little bit by sitting or lying down. She rates the pain a 6 to 7 out of 10 at the worst, which limits her ability to perform her household tasks and participate in her weekly walking group. She said she's been taking ibuprofen, 400 milligrams as needed, which reduces the pain to like a 3 or a 4. She reports morning stiffness lasting 20 to 30 minutes that improves with movement. She denied any numbness, tingling, weakness, or recent trauma. She notes occasional difficulty in bending to pick up objects, and is otherwise active for her age. No recent stressors, and has not started any new medication. So, review of systems. Gosh, I can't talk. Included general. She denied any weight loss, fatigue, fever. Skin, there's no rashes or bruising. Head, there's no headaches or scalp tenderness. Eyes, she denied blurry vision or eye pain. She does use reading glasses. Ear, nose, and throat, she denied hearing loss, sore throat, or harshness. No chest pain, palpitations, edema. Respiratory-wise, she denied any shortness of breath, no cough noted. No nausea, vomiting, or change in bowel habits. Denied any dysuria or urinary frequency, and she started menopause around age 50. She reports some lower back pain and stiffness, denies any joint pain, swelling, or muscle weakness elsewhere. Neurological, she denies any numbness, tingling, dizziness, or seizures. Psychological, she denied any depression, anxiety, or mood swings. No heat or cold intolerance or excessive hair growth. No easily bruising or swollen lymph nodes. No allergens or autoimmune disorders. Past medical history included hypertension, which was controlled with medication, osteoarthritis for her knees, which was managed conservatively. Current problem list, M54.5, chronic low back pain, hypertension, osteoarthritis. She's a retired school teacher, unfortunately widowed. She has 2 adult children, both healthy. She enjoys walks, gardening, and reading in her area, Southwest Florida. Never in military, not sexually active anymore. Denies any tobacco, occasional wine. Denies coffee, or drinks coffee daily, I apologize. No substance abuse issues, no mental health issues, no STD issues. So yeah, she had only surgery she's really had is appendectomy at age 40. No allergies. We've been treating with lisinopril for the hypertension, 10 milligrams daily, and she's been using ibuprofen. She does use a daily multivitamin. Vaccinations were up to date, annual flu and pneumonia taken. General exam, she was pleasant, well-nourished, geriatric female, no acute distress. She was alert and cooperative. Pupils were equal and reactive to light. Tympanic membranes were clear bilaterally. Nares patent. Neck was supple. Regular rate and rhythm. No murmurs, no gallops. Clear breath sounds. No wheezing. No rails. Soft, non-tender abdomen. Bowel sounds were normal. No palpable masses. Clear skin. Maybe some age-related thinning. Musculoskeletal-wise, though, slightly stooped posture. Tenderness on palpitation to the lumbar region, L4 or L3, L4, L5. Limited flexation due to pain and stiffness. Extension was mildly restricted as well. Negative leg raise bilaterally, 5 out of 5 for the lower extremities. Some swelling, minimal to the knees. Fairly normal gait, no assistive devices used currently. She does occasionally use the wall to help herself, but alert and oriented. All cranial nerves are intact. Mood was appropriate. Family history wise, father's deceased to age 80, heart disease. Mother was deceased at 85, osteoarthritis and hypertension she had as well. She does have one brother, 68, healthy still. Objective-wise, all vitals were normal. Height was 63 inches, weight 150 pounds, so she is a little bit overweight. BMI was 26.6. So assessment, we have the chronic lumbar pain with tenderness, limited lumbar flexibility. We did order a lumbar x-ray to evaluate for degenerative changes or other structural issues. Hypertension we talked about, and osteoarthritis. So ordered the lumbar x-ray. Hopefully we'll get that back to assess for degenerative disc disease or potential arthritis, that type of thing, maybe even a compression fracture. Potential differential diagnoses include M47.817, which is lumbar degenerative disc disease or osteoarthritis. Lumbar facet joint arthritis, M46.96 is another possibility. Spinal stenosis is always something we can consider, and even the compression fracture would be a possibility. So, plan for management of the chronic back pain. We're going to continue the ibuprofen every 68 hours, 400 to 600 milligrams, max 2,400 in a day. Physical therapy referral. We're doing home health in the home. She is a little limited on getting out currently. We're going to focus on core strengthening, lumbar flexibility, and posture correction. We're going to do some home exercises. We gave her some different information to look at, but physical therapy will obviously help with that as well. And, gave her some advice for some heat therapy, maybe 15 to 20 minutes a day to help relieve the stiffness. The patient and her daughter were educated about the lower back pain, prevalence in older adults, and the role of degenerative changes. They're advised to track pain severity and triggers using pain diary to monitor progress. Maybe take a calcium and vitamin D supplementation. We're going to check for labs as well. Given her age and osteoarthritis history, she's a newer patient to us. But the lumbar x-ray is ordered, and we're going to see, when that comes back, and potentially, if we need an MRI or referral out to orthopedics, we might go from there. Thanks.